Hi.
Hi.
Welcome to Crohn's and Colitis Connect.
It's a mouthful.
I'm Amy Harrell,
And I'm Alicia Barron.
and we're here for your monthly show. Thanks for
Yay.
joining us.
Yes, it's a beautiful day in Dallas.
Yeah, I know. Alicia just got in this morning from Houston, and we were just joking that every time she comes to Dallas, she brings bad weather.
I know.
So-
Sorry, guys. Sorry. I promise it'll be better next time. So next time.
But it's fall, and we've got cool weather.
You know, I think I might have willed this into being because I did say that I was enjoying the cooler weather, and I was really excited because it was finally boot season. And so then I show up, and it's now very cold and boot season officially. So sorry, I guess, but I'm excited about the boots.
Yeah.
Yeah.
Yeah, all the sweaters and, the typical wardrobe things that we get to bring out here in the South for just like, a month or so and
Maybe a couple of weeks.
pretend like we live in a place that has actual seasons. So,
Yes,
yeah.
I did see somebody wearing UGG boots in the airport, and I was thinking that's a little bit of an overkill, but it's okay.
Yeah.
To each their own.
Well, the airport is,
cold.
you get a free pass when you're in an airport with, what you're wearing and
Fair, totally fair.
yeah. So you're here in town for clinical trial ambassador training.
Yes, yeah. So we have an initiative that started. Gosh, it was more than a year ago. Our clinical trials initiative. It's we have a clinical trials community which gives a lot of information about participating in clinical trials. And I know you guys have heard me talk about this before if you watched the show. But each year we train a cohort of ambassadors, which are people who've been through clinical trials that can be able to participate in speaking engagements and educational opportunities and mentoring and things like that. So they're training them this weekend. So I'm here to kind of help out with that. I'm
Cool.
excited.
Well,
It'd be nice to meet all our new ambassadors.
I'm glad you're here.
Thanks.
And in our show today, Alicia is also going to be doing our Get Connected segment. She'll discuss resources on health insurance and open enrollment. So stay tuned for that. That's exciting.
And I'm also going to be interviewing Dr. Alessandra Ficarra from Baylor Scott and White. So I'm really excited about that because he's new to Baylor Scott and White. So we'll get a chance to meet a new colorectal surgeon over there.
He's the division chief of colon and rectal
Indeed.
surgery
He's a big
at
deal.
Baylor Scott.
Yeah.
Yes, he's a very big deal. All
Yeah.
right. Well, I'm excited about the show. I'm glad
Yeah.
you're here.
Me too. It's always fun to come on.
Yeah.
In person too, not just my
In
weird face in a
person.
video. Yeah.
We love your videos.
Yeah.
All right. So up next is Get Connected with Alicia Barron. Dr.
Hi everyone, I am going to give you some information about health insurance because I don't know if you know this, but as of November 1st, it is open enrollment. And what that means is this is the time for you to start looking at health insurance plans if you need to get one on the market or if you want to do some exploring about what health insurance plans might be the better option for you. Open enrollment lasts from November 1st to December 15th, so you do have a little bit of time to do some exploring about those plans. And we have a really great resource for you. If you go to there's one website, and then we also have a whole other website on our website. Sorry, lots of websites in that. That gives you some more information and some tips and tools and resources. So on our website, you have a listing of what the different types of health insurance plans are. So what's Medicare, what's Medicaid, what's Part A, Part B, Part C, Part D, and then also what are individual health insurance plans, what are plans that you can get through your provider and things like that. So it walks you through what all of those are. But the best thing that's on that website is as you start shopping for plans, you have a resource. It's a toolkit that you can go down. It's a checklist of information. So you pull it off the website and you're going to print copies of it and you're going to use it as you start comparing plans. So you sit down and you do one for your existing healthcare plan. And it talks about what doctors do use, what medications you take, what specifically do you need to continue to be cared for with your inflammatory bowel disease. And then it allows you to compare what you have with what the plans that you're looking at are providing. So it's a really great way for you to figure out if this plan is going to be the best option for you or not. So I really highly recommend it, especially if you're making this very, very confusing change to a new healthcare plan, to make sure that you're really getting everything that you absolutely need for your plan for the next year, because this is your opportunity to change. This is your opportunity to find something that maybe works a little bit better for you and for your family. So take a look at those resources. We're going to be sharing them on our Facebook page as well later, so you have a link to all of them. But all of those links are really great resources to help you if you are confused at all. And as usual, I'm always going to send you to the IBD Help Center. you can contact them at 888-694-8872. Those ladies can definitely walk you through and help you figure this out as well. So please do visit any of those websites and get shopping for your health insurance plans. Hello.
Hello.
Welcome. So I'm really excited to talk to you. Dr. Alessandra Ficarra, please do tell us a little bit about yourself. You are the Division Chief of the Division of Colon and Rectal Surgery. Did I get that correct?
You got it correct. Good. Thank you very much for having me. First of all, I joined Baylor September 30th, so I'm brand new to Dallas. I came from University of North Carolina. I'm a colon and rectal surgeon. I've been doing this for the last 17 years.
Okay.
Trained at University of Chicago, big place for inflammatory bowel disease, as you all know. Did my fellowship at Mount Sinai School of Medicine.
Another big name?
Big name. That's where Dr. Crohn was practicing when he described the disease. And went back to Chicago on faculty for a number of years, and University of Washington after that, University of North Carolina, and now here in Baylor. So I've worked in institutions that have had a long history of surgical and medical management of inflammatory bowel disease, and that's my interest. I think dealing with patients with Crohn's, it's really challenging and keeps everybody engaged and requires a real team effort to be successful. So that's what I really like about dealing with this type of disease.
Yeah, well, we're delighted to have somebody with your background, at Baylor Scott and White to be able to work with the IBD Center there. That's a really, I think more and more of our IBD doctors are going into that sort of mindset of putting together holistic centers that not just have GIs, but also have really well-trained PAs and maybe social workers and psychologists and dietitians and colorectal surgeons.
Right. And nutritionists. It's really a team effort. And we monthly we have a IBD conference to discuss challenging cases together with our sister institution in Temple. So it's a teleconference with them as well. Soon we'll be joining IBD Live, which is a multi-institutional, multidisciplinary conference, also once a month, where nationally we share cases that we all learn from each other. So it is indeed a team sport, really a team sport.
Yeah, well, I mean, there's so many people in the care team for people living with IBD because it's not just one little thing. It's not just your colon. It's not just, one aspect. So there's many aspects to living with this disease. So I think that's wonderful, and I think it's great that you'll be able to share that knowledge amongst your team. That's great. Yeah. So tell me a little bit about, so you've been practicing for 17 years, but why did you choose colorectal surgery and why did you choose IBD as your specialty?
So colorectal surgery goes back to my childhood in a way, because my father was a gastroenterologist. Okay. And so I grew up in his office, and I've seen patients afflicted by many diseases, but the GI tract was really what attracted me the most. And once I started medical school, I realized that I was not patient enough, perhaps, to be a gastroenterologist. Okay. I wanted something done quickly and effectively, and that's what colorectal surgery does.
Right.
And then in the big field of colorectal, I think, as I said earlier, the inflammatory bowel disease is really the most complex, challenging, and in a way also interesting. Now, when I started, there were one or two medications for ulcerative colitis and Crohn's disease. Now there is a new drug on the market every other week. So it's even more challenging, even more interesting, and even more effective. So I'm really happy for my decision, and I'm looking forward to the future, what the future is going to bring us.
Yeah. Well, so having done this 17 years, and you mentioned new medications on the market, but there's also been some surgical advances. What things have you seen, and kind of how do you see that they've affected our population particularly?
Right. When I started, all the operations were open, big incisions. Depending on the school, we like the transverse incisions versus the midline incision. Either way, it was a lot of pain and big incision, long hospital stay. Right. For patients that were already not particularly healthy to begin with. We have transitioned dramatically over a minimal invasive approach, smaller incision, faster recovery. And even though our patients perhaps now are sicker than they were before, because again, there is a new drug available every other week, with minimal invasive surgery, the recovery is better. The length of stay is shorter, and return to normal activity is faster. So those are new improvements that have occurred over the last 10 years, perhaps, and more to come as we develop less and less invasive approaches to these diseases.
So minimally invasive surgery is something we hear a lot about, but kind of what exactly does that mean? Because I know there's like laparoscopic, there's other things that sort of play into it. So describe a little bit of minimally invasive surgery.
So that is a great question, because I think the IBDologist or the IBD surgeon should have a lot of different tricks up his sleeve. Laparoscopy, robotic, and transanal approaches should all be offered at the right time for the right patient by the right surgeon. And I practice all of those. I have expertise in all those different approaches and open surgery as well. But I believe that we have to select the approach to the very specific patient and to the very specific course of his or her disease at that time.
Right, right. And you do that as part of the team, the care team that's
Right.
at Baylor Scott and White. Very
Correct,
good.
correct.
Good. Well, and with laparoscopy, that's where you have like 3 small incisions and the cameras go in, and with the robotic surgery, tell me more about robotic
Yep.
surgery, because this is new.
Yeah, robotic surgery was not specifically developed for IBD. It's utilized for urology, gynecology, and colorectal surgery in general. That also has evolved over the years. We started from a very rudimentary system about 10, 15 years ago to a very sophisticated system nowadays. And more companies are coming into the market with new platforms. So that is a field of evolution. With robotic surgery, there are some advantages for sure. A lot of the human factors taken out of the picture. You don't need an assistant. You can hold the camera and 3 or 4 arms at the same time yourself. So you don't need an assistant at the bedside. The tremor that eventually, after many hours of surgery, you start seeing is completely eliminated by the software. And the visualization is phenomenal, especially in deep down in the male pelvis. It's a lot better. So for selected cases, like as I said, pelvic surgery, reoperative surgery, obese patients, I think robotic has an advantage over laparoscopy. There are other cases that are more suitable to laparoscopy, and those cases don't justify the extra time and the extra expense of using the robot. So it's very individualized to the very specific patient and the very specific time in their disease course.
Right, right. So it really makes sense to do some research on your surgeon.
Yes.
But also the techniques that are available to you if you're facing surgery.
Yes.
Okay.
Yes.
So speaking of facing surgery, so some of our patients choose surgery. In the course of their discussion with their doctor about what's working, what's not working, surgery gets put out on the table as an option.
Right.
And something that they can then select. But a lot of our patients are really too ill, and sometimes by the time they get to you, the choice is taken away. That's kind of their only option. So talk to me about how do you prep the patients for either one of those options? Both. Tell me about both.
So there are 2 different types of patients that we meet. There is the patient that is in the hospital under the care of a gastroenterologist that is too sick to get out of the hospital, too sick to stop the medication, and you meet him or her for the first time at the worst possible time of their course.
Right.
They don't want to hear from you. They don't want to hear about surgery.
Right.
And those are challenging patients, especially when we're talking about ulcerative colitis, where the end result of the surgery is curative, but life-changing. Yeah. In a good way, but still life-changing. So those are the challenging patients where you have to sort of shift their attention to surgery's failure, to surgery is another tool to get my quality of life back. So what I do with them, I start going over their expectations. What do you like to do? What are you able to do now? You're in the hospital, so not much, unfortunately. And what would you like to do next week or next month or in 6 months? And especially younger patients, they talk about going back to work and starting a family and taking a vacation. And then the conclusion that we reach out together is that you can't, unfortunately. You are at a stage where you can't do any of this stuff. And the medications have been tried, and unfortunately, nothing is 100% effective, including IBD medications, in the best of hands. So at that point, we sort of reach the conclusion together that surgery is a must at that point. So those are the more challenging patients. And I have to say, having done hundreds of those, I think I've seen two people that almost force us to wait too long for surgery. But otherwise, you're able to, everybody is a reasonable individual, and especially if there is family involved, it's easier to bring everybody together.
Right.
The other group, the one that you either have a relationship with or that you meet in clinic electively, refer from a gastroenterologist that had prepped them for what needs to be done. He or she has tried every possible medication, so we all agree that there is nothing else. That is an easier discussion to have. IBD patients are very knowledgeable. They come with a lot of information, a lot of reading has been done already. So for those patients that come electively, the interaction is actually a lot easier.
I would imagine. Well, very good. Well, Dr. Ficarra, we are delighted that you have moved to
Thank
Dallas
you.
and
Yes.
are part of our
Yeah.
team now
Yes.
again. And I want to thank you so much for coming on, because I know you had to adjust your schedule a little bit for us. So thank you
Of course,
so much.
you're very welcome. You're very welcome.
That was so interesting. Thank you so much, Dr. Ficarra, for coming on the show today. What an interesting, I don't know, love to hear a little bit more about why physicians get into this role and what intrigues them about IBD.
Yeah, it's so fun to get to know our providers, just because so many of them come into the GI space because of either having, being affected themselves in some way because of their family member or their friends, or just having a really, impactful mentor as they were going through school. So it's always fun to kind of hear how people come to it. And a lot of our folks they like puzzles, so it sounds like maybe that's part of why they come in.
Yes, that's what I keep hearing.
Yeah.
Yeah. Well, we have a couple of minutes left in the show to kind of do our little segment about connecting with us and what all's going on, how you can get involved. And so we are just going to talk about a couple of things that we have coming up. So first of all, tomorrow is our 8th annual Night of Champions.
Yes, where we're honoring Dr. Michael Weisberg, who was our guest back in September. Yeah.
Yes.
It's going to be a great night. Amy was telling me all about the location, because I have never been to this place, and it sounds like it's going to be really cool.
Yes. The Statler, if you're from Dallas, hopefully you know about the Statler and just how exciting a venue it is. But, I think just honoring Dr. Weisberg and this being our 8th year, it's bigger and better than ever before. And we've got like a really cool vibe and a really fun show. And
Yes, and Amy was telling me there's a speakeasy in the basement, so I'm pretty excited about that as well. So that'll be really fun. But I'm excited to honor Dr. Weisberg. He's been a part of the foundation and a practitioner for a really long time. So I think it's just such a great person for us to honor.
Yeah. And then we also we're still recruiting for one of our Team Challenge events, which is Key West. And that's coming up.
Beautiful.
I know, if you want to go to Florida, there's the link, teamchallenge.org/Key West. This is the last and final event that we have for 2019 in Team Challenge. And even though it does say that it's in January, it's still one of our 2019 events.
Yep.
And
Majority
there's
of the
still
fundraising happens
time.
in 2019.
Exactly. Yeah, so there's still time to join. It is such a fun experience, having done it myself last year. You can choose the 5K, I believe. You can also choose the half marathon if you want to run, walk, or crawl, whatever you want to do. But you've got a group to train with every Saturday. Before then, you have a qualified coach to help you through if you've never done a race like this before. So just go to the website and find out if you're at all intrigued. Go find out some more information about Team Challenge. It's a really fun program to be a part of.
Well, and people find that cohort of runners that they are part of during Team Challenge, that it's really kind of, you form a little family. It's almost like a little support group of other people who get what it's like to be to have either be affected by IBD or have somebody affected by IBD in your family. And so it's a really fun way to get to know some new people, and people really create some great connections. So I think it's such a cool program. It really is.
Yes, and don't be intimidated by the half marathon length, because we have people who are starting out not having run a mile before, and they're still able to Sometimes they walk the half
Yeah.
marathon length. Sometimes they do a jog. I call it a jog, where you're just sort of like walking and running.
Yep.
That's my approach. But it's just really about the community and the people that you get to meet and the
Yeah.
cause that you're helping.
And a trip to beautiful Key West.
A trip to Key West. Yeah.
Yes, yeah. Well, and of course, you're going to start getting emails from us. You know, we are ending the year. Can you believe we're already in November? I don't know how that happened. But at the end of the year, of course, that is when we start doing our end of the year gifts. And so we start trying to see, you know, it's the end of the year, time to maybe do some donations before we get into the next tax season. And
Yes.
so end of the year giving is coming up.
Coming up. So just keep us in mind. We know that there's a lot of other organizations to support this time of year. A lot of other organizations asking for your support. So please keep us in mind as you finish out the year. You know, for any tax write-offs, we definitely depend on gifts from you to
Absolutely.
make sure that we can provide all the programming here in North Texas and keep our mission going and keep the research up to find cures and therapies for our patients. And
Absolutely.
so please keep us in mind as we close out the year.
Right, and keep an eye on your email. Just the other day, I noticed that in one of the end of the year giving emails, they were talking about somebody that was willing to do matching funds. So this is certainly, again, the time where also we have some matching fund opportunities. So it's an opportunity to really maximize your gift and get some additional funds coming towards the Crohn's and Colitis Foundation, which we so appreciate. And I know, especially as the person who sort of does the educational programs and the camp and is perhaps more this recipient of the donations, it's such a great thing that we do, and we're able to really support so many people through your gifts. So
Yes.
it's a wonderful thing.
And last but not least, we have an exciting announcement about Camp Oasis next year.
Yes, dates are set for Camp Oasis. Yay. And it's going to be early this year, so do mark your calendars. Camp is going to start on Sunday, May 31st and go to Thursday, June 4th. So it is early this coming year, but it is unfortunately the latest we could get camp. But I'm excited because it's going to get the kids in right after school and in and out and then back
Right.
about their lives for the rest of the summer. So I think it'll be fun. This year we did, during early June dates, and it worked out really well. We had the most children we've had ever. And so I'm really anticipating we're going to have another really good showing this year. So I'm excited. You know how much I love camp, so I could talk about
Yes.
camp for a year.
Such a camp cheerleader. But yeah, I mean, I think the timing is going to be really good. I think you get out of school, you're looking for something to do. A lot of parents are looking to, the transition into the summer can kind of be a hard one.
This is a good
So,
way. Send your kids to me. I'll take care of them.
Yeah, and send off is a Sunday, May 31st, and then they come back on a Thursday.
Yep. Yeah.
And that's a great way to start out the summer. And you also shared that the applications are going to be reviewed earlier this year.
Yes.
So,
Yeah. Applications are going to go live in mid-January. So last year it was early February, which makes it a really tight turnaround, which I understand for you parents. But yeah, it's going to be around about January 16th, I think, is when we're slated to do it. But best laid plans. That should be when it goes live. But start looking about mid-January, and you're going to see the applications go live. The sooner the better. The sooner you get it in, because space is limited. This year we almost maxed out. We got really, really close. And so if you want your child to go, you really need to get your application in as quickly as possible, because it is first come, first serve.
yeah.
Yeah.
ccfa.org/Camp Oasis. You can find out more information about camp.
Yep.
And
Yeah.
thank you for coming to Dallas
Thanks,
and
this was so
coming on
much
the
fun.
show. Yeah, we'll
Yeah.
have to do it again sometime.
Yeah, I know. It's always fun to talk with you, Amy, and especially on camera. That's even better.
Yeah.
Thanks, guys.
Bye.